everybody, it's Nay here. Welcome to my channel, The Radiant Nurse Nay. Today's video, we're going to be talking about the health disparity of how Black women have a much higher death rate after childbirth than other races. And why is that? How can we prevent that? How can we lower that number? You know, what can we do about it? Spreading awareness about it. That's what we're going to be talking about in this video. If something you're interested in, keep watching. Okay. So according to nationalpartnership.org, Black women are 3 to 4 times more likely to die from childbirth than white women. This expands over economic educational status. And then according to cdc.gov, Black women are more than 2 times likely to experience childbirth compared to Hispanic and white mothers. Now, with those statistics I just said, think about a Black woman that you know who has experienced some type of pregnancy complication, whether it's during pregnancy or after pregnancy. Think about a Black woman who has experienced a miscarriage or a stillbirth, where the baby was in their womb and died in their womb, or they delivered the baby but they delivered a dead baby. Think about that and how devastating that is. And you know, it kind of makes you question, like, why are these numbers higher? Why are these numbers and these deaths higher in African American women than other races? And what can we do to lower it? What can we do to lower it? So just thinking about that, keep that in mind. Thinking about that. Beyonce and Serena Williams both had life-threatening complications after the birth of their children. Serena Williams, after the birth of her first daughter, she had a pulmonary embolism 1 day after delivering her child through emergency C-section. So that's basically where a clot somewhere in the body dislodges and lodges itself in your lungs. And it can cause, shortness of breath, coughing up blood, but it also can cause death. She says in her story was a previous issue, I guess maybe during her pregnancy or whatever, and it was something she was concerned about. But when she goes to the hospital, she felt like they weren't listening to her. By the time they addressed it, it was kind of, already dire. Like she was very short of breath and weak and stuff like that before they addressed it. But if they would have listened to her sooner and took it more serious, maybe they could have prevented it from going that far. Beyonce, after the birth of her twins, she had toxemia and preeclampsia. And it basically was causing, she had swelling all over her body, and she was on bed rest for over a month before she delivered her twins by an emergency C-section. Something to know that if a woman has toxemia, she's at an increased risk for heart disease after childbirth. So that's something that she has to monitor, like her heart and things like that, her heart health, after delivering the birth of her children. So what is a health disparity? A health disparity refers to higher illness rates or mortality rates experienced by one group relative to another. So the fact that Black women die more after childbirth than white women in other races, that's a health disparity. As far as why do I think we have higher postpartum death rates among African American mothers? I'm pretty sure there's going to be a ton of reasons out there, numerous factors, but these are just some of my opinions based on what I thought of. The first thing is lack of knowledge. When I looked this topic up, there's not a ton of information about it out there. There's not a ton of information about it. There's not a ton of organizations providing awareness from it. It's lack of knowledge. I honestly didn't even know this was a health disparity until I went to nursing school. And in my nursing classes, we were talking about health disparities, food deserts, and things like that in that first class. And I was like, when I heard it, I was like, wow, that's crazy, because you don't think about it. To talk about it more, they need to have commercials on it. They need to have, different branch, maybe some type of team committed to it by the federal government to provide research and figure out ways to lower that number. The next reason, racism in healthcare. Racism in healthcare. There are still, unfortunately, some providers, medical providers, who believe, Black women or Black people can tolerate more pain. And if they think that, that could negatively impact, your childbirthing experience. There are still some people who think that Black people maybe have, as far as less sensitive nerve endings, so they can take more pain. The way pain is transmitted, and processed in our brain is the same among all races. Negatively impact care, and that's a biased thought. Any racism in healthcare. If someone is directly not treating a person, not treating a person because of, or providing excellent care to them because of the color of their skin, that exists, and that is issue. Let's see, that was the second. The third one, no insurance or gaps in healthcare insurance. Even with Medicaid and Obamacare and all these different like federally funded type of healthcare programs, there are still people who don't have health insurance, or they have health insurance and they have gaps. Health insurance is expensive. I have health insurance through my job, where my company pays so much of it, and then I pay so much of it out of each paycheck. And let me tell you, it is expensive. It is expensive. And even with paying all of that healthcare insurance, when we go to the doctor, we still have to meet up to our deductible. So we're paying up till we meet the deductible, and then even after that, it covers a percentage. So we're still paying out money. It's expensive, and you know what? Not everybody can afford that. Not everybody can afford that, and because of that, they probably, especially if they're a pregnant woman, they might put off or not go to certain doctor's appointments during pregnancy or after they deliver that they should be, because they don't, they're afraid that the health insurance isn't covering enough and they can't pay that balance. That's the issue. The next one that I thought of is lack of paid leave for women. Lack of paid leave. Even if you're pregnant, after you deliver your baby, your bill collectors do not care. They want their money. You still have to pay your bills, okay? Whether you had a baby or 2 babies, 3, 4 delivery, that you have to pay your bills. And if women are not getting proper, paid leave from their jobs, then you know what? They're going to rush to go back to their jobs maybe a little bit quicker than they should, because they have to, keep their job to pay them. My fifth one is rules or policies. There are different rules and policies that can contribute to that contribute negatively to minorities, who are receiving healthcare coverage, especially within the Medicaid policies and different things like that. I need to look more into it to see specific details, but there are rules that I think contribute to why the death rate among African American women after childbirth. Lack of diversity in healthcare. I think, you as a person of color, you understand sometimes the culture of other people of color. They're, themselves being African American culture, they kind of can maybe know how to treat certain things and talk about certain topics that other races may not understand, because they can relate better. Sometimes it's easy to relate to people who look like you. And so if you have more people, black individuals taking, who are there maybe to educate people in their healthcare system about taking care of black moms or whatever, black women or whatever, they can kind of educate them on the culture and maybe help to, that can help lower some of the, those statistics that you see out there. So, how do we decrease this number? This is just me thinking out loud and me, some of my opinions. How do we decrease this number? The first one I said is knowledge. We need to talk more about this. So just being aware that this exists, it kind of, puts you on guard. And it's like, okay, this exists, so I'm going to be more aware of it, and I'm going to educate myself on it. I'm going to ask my primary care provider questions so that, I feel comfortable and I get the excellent care that I need. The next thing is, if you experience racism in healthcare with your OBGYN or any doctor of any kind, definitely switch providers, switch doctors, find somebody who you feel comfortable with. And then you also need to report that provider. Whoever you were with that you felt like, was racist towards you, especially as OBGYN or any type of doctor, you need to report them. And the first thing you can do, you can call the hospital's HR department, or if they have like a complaint or something like that, you can call and report. If you feel like they don't take steps to it to address it, then you can call the your state's medical board and make reports there. You can also, if you have complaints against the entire hospital, you can call your state's Department of Health and Hospital Services and make reports there. That way they actually have a history of reports being made against that hospital or that doctor so that they can be addressed. The third thing is know your company's paid leave policy and about your health insurance. So you kind of, especially if you're pregnant as a pregnant woman, you know, when you're going to your doctor's appointments and things like that to deliver your baby, it's expensive and it's gonna cost some money. So you definitely need to know like what your health insurance will cover and what it won't cover, so you know kind of what needs to be paid, you know, at once you have your baby and things like that. Just use federal state programs available to you if you need, you know. So they have different federal and state programs. You know, if you need some help with things like Medicaid, they have different other things that you can sign up for if you maybe have gaps in insurance or something like that. You need some more assistance. I will go to your state website and kind of see what you can qualify for, that if you need help for paying different medical things while you are pregnant. This thing I'm talking about, if you already have a medical condition, it can be exaggerated during pregnancy. So you need to know that if you have something already, whether it's diabetes, high blood pressure, you know, thyroid issues or sickle cell anemia or any of these things, it can be complicated. It can complicate your pregnancy. So you need to monitor yourself. And you also need to make sure your doctor is monitoring it so that you can have like a healthy, safe pregnancy. They can monitor it to keep your complications to a minimum. So I would say another thing is keep your doctor's appointments. Attend all your regular doctor's appointments during pregnancy and postpartum. And if you have any weird signs or anything like that, mention that to your doctor. Advocate for yourself and your baby. If you feel like you're not being heard, go to another doctor. Get a second opinion. I think these things can kind of contribute to help decreasing this statistic. So just being aware, advocating for yourself and your baby, I think those are things that are key.